I thought he was playing in the other room. I walked in and checked on him, and he was convulsing on the floor, and he was blue. And he was so quiet. And if I didn't catch it, we probably would have lost him. Well, he's 14 and he still can't sleep alone. For many families, going to bed is a peaceful, calm time. For my family, it's just the opposite. Somebody is watching him at all times, sitting with him, laying with him, for fear that we will lose him to a seizure.
Epilepsy mortality refers to injury that results in death. It refers also to SUDEP, or sudden unexpected death in epilepsy, as well as prolonged seizures that can lead to death. Conversations about epilepsy and mortality can be very difficult, both for patients and for their families. And some may think the patients are at such low risk that it's not worth talking about and instilling that fear in the family.
When I talk to other families, many have never heard of SUDEP. They don't know what it stands for. They don't know what it means. Most of us parents are hearing from it on the internet, from other parent groups. And then you become alarmed because you didn't have that conversation with your physician.
Over and over, we have seen and been told by families whose loved ones have passed away that it would have been better if they would have known from the beginning, even though it would have made them scared. It is important for them to know and understand all the risk involved in the diagnosis. Typically, we talk to families about everything related to seizure precautions and mortality, ideally in the first visit.
As a parent, that needs to be standard practice. When we're meeting with physicians or neurologists, really having that conversation about SUDEP, the mortality rate, what are the statistics?
A lot is yet to learn. We do know that there are patients that are at higher risk of dying from SUDEP. So what we know is what to do to decrease that risk.
We have found multiple medications working for him now, and he's still seizing, but the intensity of the seizures are less. We got a service dog that will alert us of seizures. We also got a bed alarm. It's helping relieve some of that stress. He's probably always going to have seizures daily. I don't think they'll ever stop. I never want to give up hope. Discussions with epilepsy mortality is key. Parents, regardless of how scared they are, it's important that we have the tools to deal with it, to educate ourselves.